Have you ever experienced a faint hum, a buzzing, or even a high-pitched whine that seems to come from nowhere? Only you can hear it, and it just will not go away. It is a sensation many people experience, and it can be quite unsettling. Yes, ringing in your ears, a condition known as tinnitus, can absolutely be a sign of something else. While it is often harmless and temporary, sometimes it points to underlying health conditions that need attention. It is a symptom, not a disease on its own, and understanding its root cause is key to managing it. Tinnitus is the perception of sound in one or both ears or in the head when no external sound is present. This phantom sound can take many forms, like ringing, buzzing, roaring, clicking, or hissing. Most commonly, it is linked to some form of hearing loss, especially noise-induced hearing loss. When the delicate hair cells in your inner ear are damaged, they can send abnormal electrical signals to your brain, which your brain then interprets as sound. This is often the case with chronic exposure to loud noises or age-related hearing decline. However, tinnitus can also be triggered by a wide range of other factors. These include earwax blockages, which can physically impede sound and irritate the eardrum. Certain medications, especially at high doses like some antibiotics, aspirin, or even some antidepressants, can be ototoxic, meaning they damage the ear and cause temporary or permanent tinnitus. Vascular disorders, such as high blood pressure or atherosclerosis, can cause blood vessels near the ear to pulsate more forcefully, creating a sound perception known as pulsatile tinnitus. Head or neck injuries, particularly those affecting the jaw joint or inner ear, can disrupt nerve signals. Even conditions like Meniere's disease, which affects the inner ear and causes vertigo and hearing loss, list tinnitus as a key symptom. Less commonly, but importantly, tinnitus can be a rare symptom of a benign tumor on the auditory nerve, called an acoustic neuroma. This is why it is so important to have new or persistent tinnitus evaluated by a professional. If you are experiencing ringing in your ears, especially if it is new, worsening, or accompanied by other symptoms like dizziness, hearing loss, or pain, the most important step is to schedule an appointment with a healthcare professional. Start with your primary care doctor, who can perform an initial assessment and refer you to an audiologist, an ear, nose, and throat doctor, or another specialist if needed. Be prepared to describe the sound, its frequency, how long it lasts, and any other symptoms you are experiencing. They may perform a comprehensive hearing evaluation and other diagnostic tests to pinpoint the cause. Did you know there are two main types of tinnitus? Subjective tinnitus is when only you can hear the sound, and it is by far the most common type. It is usually related to nerve or sensory issues in the ear. Objective tinnitus, on the other hand, is a rare form where a doctor can also hear the sound during an examination, often with a stethoscope. This type is frequently caused by a blood vessel problem or muscle spasms in the middle ear. Another interesting fact is that while tinnitus is often associated with hearing loss, not everyone with hearing loss experiences tinnitus, and not everyone with tinnitus has hearing loss. It is a complex interaction within your auditory system and brain. Understanding that ringing in your ears can stem from various sources, from simple earwax to more significant health concerns, empowers you to take action. Recognizing tinnitus as a signal from your body allows you to seek timely professional guidance, potentially uncover an underlying issue, and find strategies to manage the sound, improving your overall well-being and peace of mind.